everyone, and welcome back. I'm here with Tamie Colon. Welcome, Tamie. You are with the Mental Health and Recovery Services Board here in Allen County. And I have no idea, after researching the website, there were so many programs and classes and just so much to offer the community that we are in. So just wanted to mention a few of those because I thought they were very interesting. The mental health first aid. Yep. And so that is like an in-aid training that teaches you how to developing a mental illness or in a crisis. So something that's very important. We talk about mental illness, you know, all throughout our nation because it's so prevalent these days. And some of the other things, a critical incident stress management team. Can you explain a little bit about that?
Yeah, so that's a team that's trained to go out into communities when there's been like a community-wide loss and to support those individuals. So schools, law enforcement who has to deal with that on a regular basis, and they're people of different fields that are trained and come together as peers to help manage the crisis all the way through. Yeah,
like the fire department, the EMS, the law enforcement, so important. I mean, they see the struggles every day, so you know, just to get that help out there with them as well is so important.
Yeah, and then to remember for every young person that has a tragic event, there's a whole school and a whole community that suffers pain from that. So helping manage through that.
That is very true. Another program I saw was PAX, P-A-X. And that is, can you explain that?
Yeah, so that's a classroom early intervention program that's evidence-based to demonstrate improvement in social emotional learning for young kids.
So. Very nice. Another one, Lost Team.
Yes.
And explain a little bit about that one.
Yeah, so oftentimes when people lose a loved one to suicide, there's a lot of shame. Oftentimes they retreat, they're isolated. And so this Lost Team is trained individuals who have experienced a loss themselves, who go out and support families and to help connect them to resources.
And then I did see another one that was called Let's Talk. I thought this one was very interesting.
Yes.
Explain that to our viewers.
So Let's Talk, we have version 1 and version 2, and we're working on version 3, and it's really helpful hints for parents on how to talk to their children about drugs and alcohol. And then we have a version on how to help children talk to their parents about drugs and alcohol so that we can get that communication going, because we know that parents still have the greatest amount of influence over children.
That is very true. Now all of these programs, I know I just touched just a short little bit of them, but there's so many more. But all of these are due to funds that come in. Now, just to mention the funds, there is a levy coming up.
There is.
Correct? Can you explain a little bit about that for us?
Yeah, so we're on the levy tomorrow. There'll be a mental health and substance use on there, and we know that people support it. This community has always supported it, but what we wanted them to know is who they're supporting, which is the board, which is charged by the Ohio Revised Code to be the steward over those local funds and to develop, plan, and administer programs for our communities.
Yeah, so you need the money to offer the programs.
It's 47% of our current operating budget. It's very important to us.
Right, and mental illness is just, like I said, so prevalent out there. We talk about it every day. We see it on the news every day. And programs like this could help for a better outcome.
They do help.
Yeah, they do help.
There you go.
Absolutely. There you go.
And I know that people sometimes aren't hearing that in the media, but all of the evidence and the data, even local data, demonstrates that the work that we're doing is helping.
Right. Well, people can't just do it on their own. It's so important sometimes just to reach out, to get a professional in there to help you, because, sometimes people are afraid to ask for help. They're scared. They think they could do it on their own, or they think it's admittance of weakness or something. But if that's what the programs are there for. And you have trained individuals. You have a good volunteer staff as well, I'm sure. And just to go out there, just to help in so many different variables. What counties actually do you? So
this board, we have 88 counties in Ohio. We have 50 boards, because many of us are multi-county. So we're Allen, Auglaize, and Hardin counties. Okay,
so you do reach a lot of our communities out there. Now, just out of curiosity, where is your location? Because it's something I don't really know.
Yeah, so our office is located on West Market Street, right here in Lima. But we, again, we have our partner agencies in all of those communities. We're responsible for housing and employment and medication for our most severe mentally ill and disabled folks in those communities. So we're always doing those types of projects with community partners.
And if somebody would want the help of your services, How do they go about doing that? Do they just make a phone call? Do they get on the website, send an email? Do they have to go through a doctor? Or how does that work?
Yeah, so, finding the resources is half the problem. And if you would call the 1-800-567-4673, which is our Hope line that the board has funded for years, they are our information referral. We also partner with 211 who has those resource information. Of course, you can always go to our website. We don't do direct services, but we can connect you to those. And we also have a YouTube, a Facebook, and we have Instagram, and it's all under We Care People.
So you're covering all the social media.
Trying to get out to as many people as we can.
And that's important because you know what? Some people might be on Facebook, some people might not be.
Yeah.
TikTok, maybe not. You know, Instagram, maybe not.
100%.
So that's good that you got the information out there. Like I said, I didn't even know until I actually did my research, and I think you guys do such a fantastic job helping our communities. And Tamie, thank you so much for coming in.
Thank you.
We really
appreciate
appreciate that as well. And don't go away because medical news is next on Noon Edition.